worker on the line. Her name is Carol Gibson. We have some research questions we want to ask her because of what's going on right now as far as the pandemic. You're on the front line, and I'd like to know what type of effects are you experiencing at this time being on the front line with dealing with the COVID-19?
Well, I can say when it first began that a lot of us was very anxious, meaning, just not really understanding what type of, the COVID-19, how it was going to affect, or, people or whatever. So when just knowing that we could possibly get it, it caused us to have a lot of anxiety. Always being stressed and worried, thinking that the instruments and the towers and different blades and stuff that they were using on the patient, that we could possibly get it. So a lot of us just was stuck in place, unsure, knowing that we have to, down up, put on our PPE, everything like that, but not knowing how severe or serious the patient was that had it, and then not knowing if they, pre-cleaned or did what they were supposed to do before sending the instruments and things down for us going upstairs the scope to in the OR to get it from the rooms where there were COVID patients. It was just, everybody was just very nervous. I even, the first time when they called and said that the scope was ready to be picked up, I froze and actually started crying because just the thought of me going to get something that could potentially harm me or hurt me. Yeah, my heart started beating fast. I started feeling like, oh my God, this could be it. I could catch this COVID. So it was a lot that we were dealing with until we pretty much got past the first month. I think everybody really just calming down and just really knowing if as long as we wash our hands like we're supposed to, social distance, and put on our PPE, maybe double up with the PPE, when we're getting any instruments or things that were used by COVID patients. So all of us, and that's just like your normal thing because you don't know who can potentially infect it. So everything that came down, we just doubled up on everything and made sure we had our masks and face shield on and gloves on, double gloves or whatever. So after, like I said, the first month, it became easier. It was a routine, almost like a routine. Okay, we're here, we're going to do what we're supposed to do. None of us had it or anything like that, but just knowing that the virus was out there and we can potentially get it, I think I started panicking every once in a while. Not as bad as it was at the beginning, but I even felt like I had, when I did have symptoms, my chest was tightening, my throat was very sore. I lost my taste buds for a few days. I ended up taking the test because I thought I had it. Took the test, my results came back negative. So even with some of my symptoms that they said, a lot of COVID patients have, I had some of the symptoms, but still didn't have the virus.
Mm-hmm.
Once I got tested, it was negative.
Well, we thank you for all that you do, and I have a couple more people want to ask some questions, if you don't mind.
Sure, that's fine.
Okay, hold on.
Okay.
Who has a question?
So I have two actually. The first one I want to ask is, how do you feel about some of the states starting to open back up? Does that like spike your anxiety, or does it give you any relief?
I'm sorry, can you say that again? I'm sorry, I didn't hear you clearly.
She would like for you to say it again. She didn't quite hear you.
Oh, sorry. How do you feel about some of the states starting to lift social distancing restrictions? So how do you feel about them starting to slowly open back up businesses?
I feel like as long as it goes slowly, because what they're finding out is that when a lot of the states reopen, they had got more patients with the COVID, and some of the patients died from it. So they're saying that, I'm not sure if it's mutating, but in some instances, it's coming back with a vengeance, like. So that is what I really don't understand, but it's, all we can do, because this is something new that we've never seen in the medical field, so they're doing their best to try to get in front of it and test people more, and give them the proper medication that they need to take to become better, but they don't know all the answers. So it's like, let's take our time. Let's slowly but surely open up. Let's not open up everything. In places where there isn't that many cases, I feel like they should open up. When you're still seeing the cases rising, I feel like they should wait. Don't open up everything. If you see certain sides of the city having less cases, then so be it. But we have to use wisdom in everything, because we don't want it to, have to shut the city back down. So if they're going to open up, I suggest, how I feel, pay attention to the other countries that have gone through it and different things, and what did they do to make it a good transition.
Okay.
Sometimes we want something so bad, but are we really ready?
Mm-hmm.
Well said.
Yeah.
And then my second question is, there's two different ways it can go. So there's the possibility this could go into next year. So how does that make you feel?
I just say we have to be very mindful. It is what it is. We have to prepare ourselves and be ready for whatever it is, however we have to do it. But I say, more people now, to me, are showing more concern about the next person, when before it was all about me. It's like now we have to be concerned about not only ourselves, but our co-workers, the person that's in front of me, the person that's beside me, the person that's behind me. So that's why the social distancing, I think, is a great thing, but we have to abide by the rules in order for all of us to be safe.
Yes. Well said.
I agree. Thank you.
You're welcome.
Anyone else?
Cynthia, you're muted still.
Huh?
Oh, I have two questions also.
Okay.
The first question is, do you feel that you will have long-term effects with anxiety due to COVID-19?
No, I think it was more so I had it really bad in the beginning, because unknown, not from, once the first month passed, I think I just had to start stepping out in faith, trusting God, not just that, listening to what was being told to me so that I can be safe. And as I'm being safe, I'm actually helping my brothers and sisters that's out here. You know, all of us that we all in this together. If we don't look out for one another or just listen, wash your hands, social distance, wear your mask. You know what I'm saying? If you're sick, stay at home. Someone can bring you whatever you need. It's not that serious. Of course, don't no one like to be locked in the house, can't go nowhere, whatever, but it's your life that you're saving. Your life and the potential lives of others. So it's more so we have to do what we have to do.
Right.
We taking a stand for what we believe and what we want. If we don't take the stand and do it, then who will?
Right. And then my second question is, do you feel that you have been placed in a position where you have to constantly console your coworkers due to the COVID-19?
Do I feel what?
That you have been placed in a position where you have to constantly console your coworkers due to the COVID-19?
Yeah, every now and then we do. We console each other. Because if we hear like at our hospital, when a patient goes home, they recover from COVID and they go home, they play the person's favorite song. So I think that was very touching. On some of our days, we have furlough, and those are the days we have to work in different departments, still get paid for check. So one day I was working in the tower, and the person that was working with me, he had got a call 30 minutes before we got off our shift that his grandmother died from COVID. And it tore me up. Yeah, it tore me up, and I was just like, oh my God, we have to look out for each other. I didn't know this person. He was from another culture, but I didn't care. I just, in my heart, I just felt like that could have been me. And in my heart, I felt like, okay, well, what can I do to make him feel better? How can we come together and really let each other know I'm here for you? Seriously. And I feel like so often we don't think beyond ourselves and our family, and there's a lot of people out here hurting that you don't even know.
Wow.
Like, sure, because, women, I feel like we talk to each other more. We open up a little bit more. But this was a man, and he was married, children, everything. But you could see the pain. I could feel his pain. And this is the thing that what I realized what this epidemic has done has made us think of someone else more.
Right.
Put yourself in that person's shoes. And how could you be of assistance to that person? You know what I'm saying? The norm is, I'm at work, I'm going to do my 8 hours, I'm going to go home and take care of me and my family. But now everyone is looking out for the next person or trying to do whatever they can for the next person.
Right. Well, thank you.
Yeah.
I have a couple of questions, a few questions. One thing is you said that when people get it again, it's like coming back with a vengeance. So do you think if you get it a second time, that's like kind of like almost a death sentence for you? Or are you seeing people recover from getting it a second time?
From what I heard, people are recovering, and so far, I'm not here, or at least at the hospital where I work, they haven't got it a second time or didn't come back. But to me, what it's showing us is we have to be more responsible for our health. We have to eat better. We need to take our vitamins. We need to build up our immune system, be more aware of what's going on within yourself. So therefore, if anything comes to attack you, your body can fight. you'll be strong enough to fight it. But if you don't have your immune system built up and it's strong, how you gonna fight it?
Right.
That's why so many people that have gotten it, if they haven't been taking care of themselves, or if they have low vitamin D, if they have anything, it attacks them more and it makes it worse for them.
Yeah. Okay. Another question I have is just can you explain exactly what PPE is in the medical field? Because we know like PPE could just be gloves and a mask, but what is it actually in the medical field? What do you guys wear to protect yourself?
Okay. We wear the bonnets. Most of the time we put on more than one bonnet because it's very thin and you can pretty much see through it. So we put on bonnets. That's from the top, starting with your head, we put on bonnets. We have face shields or face masks. We have face shields. We have gowns, gloves, and boot covers that go over your shoes. Some go over your shoes and it go to your ankle, or you can have the ones that go from your shoe. So if you put it on, and it goes from your shoe to your kneecap. And that PPE is most likely worn in Gibson town, and that's the dirty area of the of STD, which is sterile processing, where it all begins. It begins in Deacon town, and that's where all the soil instruments come down from the OR, which the surgeons have used on the patients. So once we go down to Deacon's Head, that's where we begin to clean the instruments. So we are prepared with all our PPE on. So imagine 2 bonnets, your face mask, maybe 2, your face shield it goes around your head and in the front of your face, underneath your chin. Then you have your gown on, a paper one, and then a plastic one goes over the paper one. Then you have your gloves on, a thin pair and then a thick pair. Your boot covers, your gown go all the way down past your knees, and your shoe covers from your foot up to your knees. And this is to protect you, mainly your clothing and everything that you have on your uniform that you have on your underneath. So whatever you get in contact with, it doesn't touch you. It doesn't get on your clothing and touch your skin.
And you're working your whole shift in all this equipment, right?
Yes.
Is it any way kind of affecting y'all work quality? Because that's a lot of stuff you just named. I didn't know it was that many layers.
Yeah, but we double up because we don't know what patient okay, we have to act like everything that they're sending down from the OR is potentially COVID. Meaning patients that they've used it on COVID patients. So you have to, when you in Deacon's Head, you have to act like everything that's coming down to Deacon's Head is COVID. So anytime you have something like that, we always double up. Yeah, we always double up. And everything that comes down that's COVID, if they let you know, because most of the time they let you know, that is washed in a machine by itself, and you wash it, you let the machine wash once, and then you wash it twice. I do it 3 times.
Is it harder for you to work in all that PPE? Is it making it harder for you to work?
No, to me, it's just being safer.
Okay.
That's so good. I mean, since it started, I've been doing like the towers and the scopes from the COVID patients, and so far so good. I haven't gotten it.
Okay, that's good. We thank God for that. So I have another question. We know, like at the beginning, I'm sorry. Oh, at the beginning of this this pandemic, PPE was very scarce in the medical field. It was very limited. How is it now? Do you guys feel like you have a adequate amount?
It's still scarce because normally our mask, the face shield, we change it every day. You're really supposed to use that stuff once and throw that stuff away because as they said, the COVID-19 sticks to plastic. Our face shields is plastic. We've been having to clean them until I use one per week. When before this occurred, we was exchanging our face shields every day. Every time you use it, you wear it, you throw it away. So we've been having to clean it. You clean your own face shield and you hold on to your face shield. I've been holding on to mine for a week. After that week, I get another one, but that's 5 days when we used to wear them and throw them away.
Yeah.
Whatever is on it, it's in the garbage.
That's
the thing.
that's how I figured. That's
You can think that you properly clean that plastic, but if it's sticking to plastic, how do we know?
right. So I have two more questions. One is, have you personally witnessed any patients? Well, I know you work in a different field, a different area of the hospital, but have you, in the hospital that you work in, have you seen patients die from the virus, or has it your hospital been like more recoveries?
Okay. Well, I'm gonna say this. I've seen them walk past with the bed. I've seen it twice since the COVID. Beforehand, I've never seen it. But because of the epidemic, this is what, it's like they say, well, you sit here a little longer on this side, you'll see more. I want to see more.
So this is my last question. Are they offering like free counseling services for the essential workers at your place of business, or do you know any place that's offering free counseling service for those who are on the front line, especially in the medical field?
We will have to probably go to our HR or go to employee health to find that out. I haven't heard it, or I haven't gotten an email about it, so I couldn't, I'm gonna say, I don't think that they even thought this far.
Do you think it would be beneficial for them to offer those type of services free of charge?
Oh, yes, because just because I talk about it and a few of my other coworkers talk about it don't mean that everyone else is talking about it. And they only, if they say something, they mention it maybe once or twice, and that's it. So you don't know what's really going on inside of people. You don't know how they feel. You don't know if they got family members that's died from it. They can go reach out and hug their family members that may have died from it. You know what I'm saying? And this is the issue at hand. When you have loved ones that may have gotten it and they're in the hospital and you can't go hug them and see about them and kiss them and let them know that I'm here for you, I'm praying for you, that weighs on your heart.
Yes, it definitely does. Well, I thank you for everything that you're doing. I pray that you continue to be safe and COVID free. I don't know you personally, but I'm praying for you and I'm praying for those in your hospital. Thank you for taking your time. I don't know if anybody else has any other questions.
Oh, no, I just want to thank you very much for your time and your patience and helping us with our project.
Thank you.
Please stay safe.
Thank you very much. We appreciate you. Enjoy your day.
Stay safe.
Stay
Be
safe.
safe.
Have a good day.
Okay, you too.
Bye-bye.
Okay,
Wow.
ladies. Whoa, that was a lot.
Yes.
I got it, Mommy. I got it.
Oh.
That was a eye opener for me. That that much of, I mean, what everything that she said, because I thought honestly, like especially PPE, that they had, gotten more equipment. Not that it was still like a scarce commodity.
Yeah, I think it depends on the hospital that you work for, but I think all over it's pretty much scarce. And so what they're doing is trying to make sure that they actually don't run out of everything. So reality is that PPE is supposed to goes in the garbage with each use. When you're done with it, you dispose of it. But I think such a big shortage that they're like trying to limit how many times you throw it away.
Yeah, like she said, she's wearing that outfit all day long. That's her outfit all day, and even her face mask is for 1 week.
That's a lot.
And you know what I noticed? That people that wear that all day, sometimes their face be red and wept up. And sometimes that mask, it breaks their face out. That's a lot to have to wear that all day.
Because putting all that on, it heats the body up. It makes you sweat.
Yeah.
It makes you uncomfortable. It makes you sticky.
And it can be hard to breathe for people that's asthmatic.
It's hard for everybody doing that.
Sometimes it's hard for me to breathe in my mask when I go outside. I'm like, oh Lord.
Me too. It's very hard for me to breathe.
Because you breathing in all your hot air.
Yeah.
And it must be scary to, like she said, the virus can stick to plastic. So like to have to continue to wear this thing and clean it yourself. I mean, we disinfect and stuff, but we don't really know for sure if we might miss a little area or something, and that may be the spot where the COVID-19 is at. So I know it has to be kind of nerve-wracking to go through that every day. She really gave us a lot of
detail,
insight in what other people are going through in other hospitals. Because I know a couple of people, like my sister works in the medical field, and she's from hospital to hospital. So she's not even in one hospital. She's a manager. So just going into these different, facilities, and they have different rates of the patients with the COVID-19. So you really don't know. And I know some people that work at Rush, and I know that Rush was a big hospital that housed COVID-19 patients. And it's just a scary thing. I don't think right now that people are really taking it too serious. I think as time goes on, we as Americans kind of get bored with stuff and like, especially if you don't know someone personally that has contracted the virus and died from it, you're kind of like, that's kind of far from me. But she made a great point saying that we have to, think about others more, not just ourselves, and be safe and be precautious. Yeah, because I'm gonna be honest. Even though they're like lifting up some of these bans or saying opening up different stuff, I'm like, no, I'm gonna wait to go outside. I'm gonna wait till the second wave. Let's see what happens first, and then I'll see.
Well, my job is saying that we have to come back July the 1st, so that's gonna be different because we sit close next to our coworkers. So they're gonna have to figure out something because we supposed to be 6 feet apart. We shouldn't be that close to each other.
Maybe they've changed the seating by the time y'all maybe they'll have separated out or something.
Well, I'll let you know, but I doubt it. That's Cook County, child. They cheap.
It's probably an assumption. It may that's probably where they're headed, but don't mean it's gonna happen.
Mm-hmm.
Making plans for that, but doesn't mean that the plans will go through.
Right, because that's going to take money and time to separate everything like that.
Well, I plan on just staying in. I don't plan on, if they lift up as far as quarantine, I plan on just being, like she said, use wisdom and be smart, when you're making certain decisions for yourself, your family.
Well, I wish I could continue to work from home, but it don't look like that's going to happen.
Well, we want to tell everybody to continue to stay safe. Keep in mind the essential workers. If you're a praying person, pray for them, lift them up. Do kind things, gifts, little kind gestures to let them know that they're appreciated and that we're thinking about them. Because even grocery store people, every time I go to the grocery store, I'm telling the people, stay safe. I appreciate you. Because I got to feed my family too, and they're in there risking themselves every day to help us out. So just keep them, we want to let everybody know, just to keep them in mind. And B, I feel like now at this time, it's it's very important to be kind to one another and polite, you know, when you're going to the stores and stuff, and these people are there servicing us, you know, just to respect them in their positions and just be kind and polite. Everybody's going through something right now.
And let them know that we appreciate you. We appreciate you, because if you wasn't here, the stores wasn't open to serve us. What would we do for food? What would we do?
Right.
Okay, this comes to the end of our video. We want to thank our guest today for her insight and all her wisdom that she gave us. And we'll see you guys next time. Bye-bye.
Bye.
Bye.